All right, good morning and welcome to Brooklyn Council 2024. Hope everyone had a happy new year. Just quick reminder before we start, please be respectful of everyone presenting and speaking. If you have specific or personal issues or concerns, please reach out privately. One of us can try to assist you or at least connect you with the person that can help you best. At today's meeting, we will have updates from OPW, from IAC, and a
Good
presentation by
morning.
Paola Martinez on future planning. Paola is from the New York Lawyers for the Public Interest. I don't believe we're going to have anyone from DOH here. We're still waiting on them to assign a new person to come to the councils to do their updates. And just a quick couple of updates from the council. This month, we had the reemergence of our employment and legislative committees. Thank you to the chairs for that. Please keep an eye out on our website and emails to attend those meetings. The employment one might be new for the Brooklyn Council, but legislative we've had for a number of years and just got it restarted again. And I see Lucina's on here, so thank you to her for that. Over the last 2 weeks, and I'm sure you'll hear more from either OPW or Richard from IAC, the Governor Hochul, held her State of the State and released her budget priorities. Unfortunately, we fell a little short in our asks. Not really anything new. But I'm sure, like I said, Richard from IAC will probably go into some greater detail. And over the next couple of months, I'm sure we'll get Winnie coming through to give us a full breakdown to the council over what was and was not included in the budget and how to shape our advocacy going forward. And the biggest reminder from the council, the 5-borough legislative breakfast planning is underway. Please save the date, Friday, March 1st, 10 a.m. The registration link is open. It was mailed out last week. It's also on our Facebook and our website, bkddcouncil.org. So please start registering, get that on your calendars. It should be another great event. With that being said, is there anyone I didn't see yet, but anyone from OPW to give an update? All right. So Richard, we'll let you go first, and when OPW comes on, they'll go after you.
Okay. And yes, the governor's budget just came out, I guess it was last week, and everyone's been analyzing it. And I'll give an overview. The important dates to hold on your calendar are January 25th and January 31st. We're going to give a briefing for IAC members and for the 5 New York City DD Council. As soon as that's finalized, we'll get that out. We'll send the links. January 25th will be at 3 o'clock, and January 31st will be at 10 a.m. And there's still a lot evolving with the budget, getting explanations of what means what, not just in OPW, but in education and health. So in the OPW world, we were pushing for a 3.2% COLA to be in the governor's budget because that's the best bet for that staying there. But unfortunately, in the budget is a 1.5% COLA and did not include the $4,000 DSP enhancement that we are pushing for. So you're going to hear a lot more advocacy about that. And there's $15 million in the governor's budget for independent living opportunities. And that's separate from the last 5 years where they had a total of $25 million a year, $1 billion a year, a 5-year investment in affordable and supportive housing. So there's an additional $15 million for independent living opportunities. We don't have the details on that yet, but we will. There's $30 million set aside under the category of new service opportunities. And so far, all we've been able to find out, that's a very broad category. It could be anything from residential for aging out people to fair market rental costs, moving people from residential schools and to and from transportation. So that needs to be broken out. And 30 million is not a great amount of money. There is or will be 57 million of state funds to increase the minimum wage, which we're not sure exactly how that will be given to providers. We're working on that, but that's something that OPW is committed to. OPW is committed to becoming an employment first state. We're one of the few states that were not categorized as such. So there's $6.7 million this year towards the employment first effort, and over 4 years there'll be $20 million. There's also legislation, or she's proposing legislation to allow direct service professionals in certified settings to perform certain nursing tasks. That's mostly directed at the medication administration. You know, in certified settings, people can be certified in under AMAP, which trains people and certifies people to do medications. They're looking to have legislation approved that will allow people in non-certified residential settings to administer medication. They want that to go into effect on April 1st. We're not sure how that will go over with the Office of Professions with State Ed or with the Nursing Association, but we'll push hard. OPW believes that there's a lot of people that are in certified settings that can move into more independent settings if they had somebody to give them medication. So that's something going on. The state director in the chief disability office has been given $250,000 to get somebody hired to oversee the Olmstead plan in New York State. That's to oversee that people get their services in the most integrated and appropriate settings for their needs. State employees under PEF, Professional Employees Federation. I forget what it stands for. But the governor is proposing a 3% salary increase and a $3,000 bonus for those employees, which I would think would drive money also towards the CSE employees and hopefully towards our employees. And there's $1 million for Special Olympics. We've also found out outside the governor's presentation that they're putting $3 million aside for home enabling supports. I think that's electronic support for people living independently that will hopefully enable them in their home. And I think, and under OMIG, there's something in the budget about Justice Center is required to report to OMIG anytime they're aware of a report. And the language clarifies that those incidents will only be reported to OMIG after all the appeals are exhausted. And there'll be a small increase. Room and board this year will get an extra $8 million from OPW into the residences because of the SSI COLA. So that portion of SSI that went up is a state savings. So that money will go into staffing into the residences. We don't know exactly how they'll be done. And there's also projected a 4% rate cut to the CCOs. They've had an enhanced rate for a certain number of years. But again, we don't know the details yet on that. So that's the OPW budget. Under education, the overall education budget's increasing their what's called foundation aid. That's your basic funding by 2.1%, and that's usually what our non-public schools get funded for an increase. State ed does not submit its budget to the governor or to Division of Budget until April, and then that's what changes gives the preschools and school age programs an increase. They're still committed to creating a new rate methodology for the preschools and school age programs. Unfortunately, even though they're asking for $1.4 million to help with that effort to redo the rate methodology, right now it's not targeted to be in place until 2029. So we got to push that forward, because that's just too long to wait, because this has been a long-term, never-ending attempt to improve the rate setting for our preschools. Kind of aside from that, if you subscribe or see an article under the education publication Chalkbeat, they raised the issue of how last year our preschool programs got the enhanced funding to extend the day by an hour and a half and provide more funding for the teachers and teacher assistants so they could attract more people. It was all under the effort of parity with the New York City Board of Ed. And unfortunately, all the money that went into that effort was COVID money. And what goes away on June 30th? COVID money. So there's a lot of effort to identify funds to keep that going. A lot of our schools have reported they used those funds last year not only to extend the day for the children, but to give substantial raises to the teachers, which will help with retention and recruitment. We have examples of teachers who got a $20,000 increase in their salary. And if you go to tell them now that that money is not going to be there come July 1st, we're not going to do real well. So major efforts going on. IAC is part of it. And actually, that's where Chris Trieber is right now at a meeting with that group. They've been meeting with legislators, city council people, the mayor's office. That combined with right now, there's about 1,100 preschool students sitting at home who have an IEP, but they're not getting services because there aren't enough classrooms that are available, and that's because you can't find the teachers who will work for the salaries that the preschools can offer. So that's and that's only going to increase as children come out of early intervention. So that one-time relief money last year, which we thought was great, isn't going to be there. So they have to identify new money. So I think that's it under education. Okay, and there is some good news under Department of Health for the early intervention program. As you know, since it was started in 1994, and the rates for those services have not gone up. They a couple times went up temporarily, then it was pulled back. The new health commissioner is very supportive of early intervention and was originally supporting an 11% increase, which is what we asked for last year. The governor's budget includes a 4% increase in the rates, but the day after the governor reported that, Senator Gustavo Rivera, who's the chair of the Senate Health Committee, and Assemblywoman Paulman, who's the chair of the Assembly Health Committee, have both putting forward a proposal to increase the rates by 11%. There's acknowledgement of the number of children that have are not being reached, primarily in certain neighborhoods who don't have the services available. If you remember way back when, in early intervention, it was hard, even when the money was flowing and a lot of people were trying to get into early intervention services. It was difficult getting people into certain neighborhoods in the Bronx or Brooklyn to provide that services. The city really pushed providers to do that, but since then the money has just like dried up and the numbers have gone down. So hopefully early intervention will be on its way back, because that's such an important time in a child's life. And you'll be hearing a lot about over the next few years about the 1115 waiver amendment. That's primarily, and the money in the budget's like $7.58 billion. It's mainly targeted to healthcare initiatives, but we believe that some of that money will come to the IDD world, and we'll keep pushing for that. There's money in there to expand access to quality dental care. There's money in the budget for, or they're proposing legislation to allow New York to join what's known as the Interstate Licensure Compact that used to exist. I think it just faded away, but that would allow physicians and nurses who are licensed in nearby states to come into New York and work and help with the nursing shortage and the medical care shortage. So those are the main highlights. I don't know if people have any questions. I'll see if I can answer them.
Richard, did you just want to mention a couple of the events that are planned? I know it's IAC, NIDA, but some of the advocacy events, do you have the dates in front of you just to mention to the group?
Thank you. That was the first thing I was supposed to say. That's why you're there, Brian. Thanks. Yeah, this year, our lobbying efforts, IAC is part of a statewide association called NIDA, New York Disability Advocates. State CP, NYSAR, New York Alliance, NYLPI are all part of NIDA. And the goal is to have an ongoing presence in Albany during lobbying season. The first big event, and they have each region scheduled, but the first big event is February 12th, which will be a rally in the War Room, similar to the one back on November 12th. So you'll be seeing flyers about that. You don't need to register for the rally, just need people to show up. I know last time New York City had a pretty good presence at that rally. And also on the 12th and the 13th are what we call leadership meetings. That's where typically board members and other leaders within the associations meet with the leadership of the Assembly and Senate. The big days for New York City are March 4th and 5th. It'll also be the Central New York legislative visits. We've sent out our lobbying registration forms. They were sent to primarily your executive directors. And I think we've spread out that email a little bit more, but if you're someone who is interested in going to our lobby days, you can send me an email and we will get that out to you. And my email is richard@iacny.org. And I see Chris Greif has his hand up.
I just have, wait 1 second before you go, Chris. I just have one follow-up to that, Richard. When I know it goes out to all the agencies when you do the signups. Does it go to the family groups as well?
It goes to the family groups. I'm not sure exactly what their plans will be. If that'll be separate or these set of days are primarily for providers. And
Gotcha.
I know New York City Fair has its own efforts going on. which we totally support. And we've always enjoyed families being on our lobbying teams. Excuse me. A difference this year, one of the differences is we used to visit legislators according to what service programs are in their district. This year, we're asking people who sign up for lobbying to include their address and zip code. And we're going to have the lobbyists go meet the legislators in their home district. So Brian, you're going to go, whatever district you're in, you're going to visit that legislator and make the points that we're pushing. So we'll see how that goes. People who live outside New York City will become members of other teams to support the effort. Thanks, Brian.
Thank you, Richard. Chris, go ahead with your question.
Well, Brian, I actually appreciate you did say that one question. That's actually, I'm glad you mentioned about the families. But here's one thing. We do have individuals as well that do also want to attend. So I'm going to say as an individual, Richard, that it'd be important that we inform the individuals who are not self-advocacies should also be attending to go see their elected officials in their districts as well, because we don't want to leave them out as well.
Absolutely not. That's always been a
yeah.
practice at IAC, the self-advocates coming and being part of a team.
Yeah.
And honestly, I have to follow up on that and see how we're accommodating the self-advocates who want to go on lobbying days. So thanks for bringing that up, Chris.
Yes, and just to add one thing, I'm just saying to everyone on the record, since I'm not a self-advocate, I am an advocate for it with the regular time as an individual advocate, because I have my own thing. But getting back one question, I think you need to be aware, Richard, also, and send this to Chris Treeben. I think he's aware that due to the fact that District 75 is maybe, you might hear cuts coming in. I did send that to Brian this morning. It's been on our emails for the last week. I know Lucina and everyone here, as well as everyone here, because if I say everyone, they will be here until next year. There is a concern in the education area because you're hearing cuts, and I'm looking like, why should we hear cuts from District 75 or those students who are in school? There is a concern on this, and I think we definitely need to hear what IAC is going to do, because this is a serious matter. Plus, the hospitals, now we're hearing in Brooklyn, the SUNY downstate across from Kings County is now, I'm hearing now, they're planning to close. And that's a heavy, heavy persons with disability going on right now. It's been mentioned on ABC News. Even this morning was mentioned. What is IAC going to do? Because since we have a lot of individuals who use SUNY as well, and some do use Kings County, which we know Kings County is not shutting, because that would be a suicide mission. I don't want to go back to 30 years already. I want to stay in the present. But there is a lot of things we need to keep our eye on, and mentioning our elected officials that don't want to hear the word closing of a hospital or cuts in District 75. These are, serious that I shouldn't even have to hear the word cuts on libraries again. It's annoying. So what I'm asking you and Winnie, as well as Chris Treeben and Mary, what is IAC going to do? And I think we should all work together with both councils with an S, advisory, DD Council, New York City Affairs, all together to make this clear that no cuts at all, period. Thank you.
Thank you, Chris. No, the city cuts are very alarming. Not only that the COVID money won't be there to help the preschools, but when the mayor announced the 5% cut, totaling 15% over the year to all city programs, including Department of Education. It's very concerning. I read in the paper, I guess, well, I don't know, it was over the weekend or last week, about SUNY possibly closing, and Kings County, in that article, didn't say what's going to happen to them. But, OPW's START program uses Kings County as one of the centers for people who go in the START program temporarily. So, yeah, thanks for bringing that up again. I'll go talk to Winnie after this meeting and see what's going on there.
Richard, just to let you know, and it has been mentioned, Kings County, they're not closing Kings County, but SUNY, they might still keep a piece SUNY open for people with disabilities, but I think we just need to keep an eye on what SUNY's going to do, because Kings County is not being touched at all.
Right.
But you never know, something can happen, but we should still check all facts at all costs.
All right. It's not good when the city starts saying they're going to cut programs 15%. Not helpful. Anybody else?
Any other questions for Richard? All right, I don't see any. Thank you so much, Richard.
Okay, and I'll be on till about 11 o'clock. So anything comes up, I'll jump in or I'll make notes.
I don't have a question for Richard, but I think Chatbit on January 11 put a report about New York City not going forward with the cuts. So I don't know if there are other news after that, but that's the last that I heard. And I could put the article.
I saw that as well. The cut specifically for the schools, right, Paola?
Yes, but District 75, yes.
Yeah. Yeah, I believe the mayor retracted that last week or the week before, that they would not be making the cuts to the schools.
Right.
Rochelle.
Yeah, I was going to mention that as well, but I think we're in a catch-22 because I find it so alarming when I hear about 1,100 children sitting home who require special ed preschool services. And then these children may or may not wind up in District 75 schools. We have to worry about the enrollment for District 75 because their funding is based on per student enrollment. So I think we really have to take this preschool situation very seriously, because these children will be set back many, many years if they don't get these preschool services.
And it's the same with early intervention. You know, children birth through 3, if they're not getting the interventions and the assistance they need, it's then more end up in preschool, more end up in special education. I did just remember another thing I wanted to mention. It came up at the Queen's Council. I'm not sure how widespread it is, but a parent reported that parents that they know in District 75 schools aren't very familiar or well versed with the transition process from the schools to adult services. And apparently this group of parents are saying, you know, don't I get a residential placement when my child graduates from school? I'm like, oh. So it reminded me, we used to have very good relationships, and maybe Brooklyn does, good relationship with the transition coordinators at District 75, and used to go to meetings at the school to brief parents on the process. So it might be something we have to rev up again and get back into the schools and assist parents of how to access services in the adult world. And it's not an entitlement like school is. So stay tuned for that.
Ellen has her hand up.
Hi, good morning.
Morning.
I just wanted to remind people that 5% cuts have already occurred in the education system. So there is less money, but the mayor has backed off on District 75, but it doesn't mean that he's backed off on the rest of the system. So as services or money lessens, there may be an increase in referral, not only for District 75, but all across the special education continuum. And honest to God, I've never worked in a time period where somebody said there was enough money. I think sometimes it's like a red flag they wave in front of a bull, and you kind of chuckle at the response they get from us. Not to say that we shouldn't respond, it's just that sometimes I wonder about the honesty and the reflection on money and programming.
All right, thank you. Paola, you have your hand up?
Yes, I just to comment regarding transition. Transitions have always been an issue in terms for parents getting the
Hello.
right information. So
Hello.
they are, New York City have what is called transition centers, perhaps that they should be helping the families. However, I don't hear them mention anything or around when the parents' families call us. Nobody knows about the transition centers, but they do assist. Also, including NYC have a great deal of information, and they are a parent center, and they also work a lot in transition. So if any parent have any questions, we can send them to including NYC, because they do have a lot of workshops and information to families. However, I agree it should be DOE doing the job. But once again, transition has always been a process in which there is a lot of misinformation, no information. And sometimes when parents call us here at New York Lawyers is when, and we look to the IEP, is when we point out the things in transition that should be happening that are not happening. So once again, a lot of work to be done in that area. Thanks.
And I've also noticed that it's been a little slow to bounce back since COVID, letting the agencies in the schools. There used to be a lot more transition fairs and meetings in the individual schools with providers and OPW, and starting early with the families to learn the process. And while I still get a couple of invites, it's not what it was pre-COVID from the agency side of things. So that's definitely impacting it as well. Lucina, you have your hand up.
Oh, hi, good morning, everyone. You talk about the transitioning. I mean, it is partial DOE and also part of OPWDD, because some of the transitioning information, half of the parents don't even know what's happening, and to be informed. And it is, as parents, it's our duty also to ask the questions, because some families are afraid to ask the questions and they feel it's a retaliation, or I will not get the support I need. I know the transition, like Paola was saying, I know the transition center do exist. And again, when I work with the parents, especially, I say it is your imperative that you ask a question or you call or find the support you need to do that. Because raising a child with disability is very overwhelming. There's a lot of the paperwork to do and what needs to be done. But again, as parents use their voice, things can change. But we have to be able to empower the parents by giving them the ammunition or the tools to do it. And that's why, yes, having the DD Council, whether Chris and the Family's Advisory, to make sure that people are getting information. Because I've gone to many of these fairs you talk about, Brian, and you see one or two persons, whether COVID or not, life still has to go on. It is our responsibility to get the information, especially for preschool. When I see some of the families come in and they don't even understand their own IEPs or the IFSP, making sure that is important. I tell parents, take a day, sometimes take a night, have a cup of coffee or something and go over your child's IEP so you know what's happening. So yes, having transition is very important at both ends, the DOE and OPWDD, because sometimes OPWDD is not even giving the parents the right information as well. So we as providers have to be very astute as well as what information we provide. I know it could be a lot of paperwork sometimes, and even utilizing our care coordinators. That's why they're there to help in that process too. So thank
you, Lucina. Ellen, you have your hand up again? No. All right. So thank you, Richard. I don't think there's any more questions for you. Is anyone here from OPWDD to give their update?
Brian, I have not seen anyone from OPWDD, but I'm hearing they've been having Wi-Fi issues at the DDRO. So I will try to see what's going on. Stand by.
All right, appreciate that. I know they
And,
usually contact me if they aren't able to attend, so it's a little strange today. Hope everything's all right with
Copy that.
our friends in Brooklyn. Ellen, do you have a question? I saw your hand went back up.
Yes. talking about OPWDD, in the last few weeks on some of the boards and in some of the questions I've been getting, people are very confused about the new ADM and the eligibility for services. Statements have been made about nobody can get anything from OPWDD until they're 8, or that in order to get any services prior to 8, you have to apply for 2 services. That there's a lot of confusion. I would hope that the next meeting, we could have somebody from OPWDD who could explain again the ADM, or to go back to your thought about how you haven't seen any widespread attempt to convene families, maybe structure some sort of online event to explain to families what the new requirements are. Even the FIs and the coordinators are confused. So people are getting a lot of confusing information. It might be helpful. And it also, if there is going to be a lobby day for those folks who are going up, I really, 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 really would urge people to be well aware of what the new ADM requires or changed, so that we don't get tripped up.
You are muted, Brian, if you're speaking to us.
Thank you, Maria. After all this time in COVID, you figure I'd remember to unmute. I
You're
was just
welcome.
mentioning, to your first point, Ellen, the other issue that when it comes to eligibility and enrollments, it varies across the boroughs, which makes it even more confusing. So a family may hear something, or a provider may hear something in Brooklyn, and it's very different in Queens, and it's even different again in the Bronx and Manhattan, and no one knows where to go with that. And I know OPW is trying to work to make sure that everyone's getting the same message across the boroughs, but you know how things go when changes happen and new regulations come out. It takes time. Debbie, you have your hand up?
Yes, and I'm going to answer Ellen. Ellen, the reason a lot of people are confused is, one, they do not, one, keep up with there are changes that are listed every day from OPWDD on the website. I am chair of the subcommittee for the ADM. There are certain services they're not allowing anymore. But they have brought back, they've cut that. You do not have to have a doctor's justification for everything, unless it is medically related to the child's developmental disability. You could also, Ellen, come to our meetings and we will tell you what's been going on. Also, the next statewide meeting is on March 6th. What also is, they are trying to not get children to have the Medicaid waiver at 8. And yes, we told the families they disagree. They should be advocating with us. The changes on the ADM, you do not have to have a life plan or care manager. You can just you have to be OPWDD eligible. If you just get straight family support, which is fine, it's the child psychological, psychosocial that's included with the forms, and it has to be the OPWDD form, as well as their consumer satisfaction surveys. I'm not going to go through everything, but they have heard loud and clear from the statewide. All of us have told them, you went from being very easy but not consistent, and we asked you, but you turned it into being draconian in what's allowed or not. What we asked you was consistency across the 19 counties, but make it to the point where a family can still order it. So if you need more, you can go on. They have been making a lot of changes, but it's called Families Have to Advocate, and also come to the advisory councils, whichever borough they're in, so we could assist them. If they're having trouble, also, you can't blame the local DDROs. If for Brooklyn, they contact Angela Blades, or if you can't get her supervisor, Robin Mooney, or above her is Lucy O'Mazey. So if there are other things you'd like to discuss, we should discuss it at a different time, okay?
No, I'm gonna push back on that. We're talking to each other. We're telling each other what we already know.
I
The
brought
plan-
this up.
The
No,
plan
no,
should
no.
be, what are we telling other people? We should have a unified voice. We should have something, whether it's in writing or etched on your soul. I don't care, but no, I don't think that's a sufficient answer. I think
Yes,
that
that is,
we are
Ellen.
failing the people that we
Oh.
serve by not providing them with an opportunity to either meet with and or express their concerns to the folks from OPW.
Ellen, were you at the
Brian,
last?
if I might
Uh,
intervene, if I can intervene,
Ladies, take this,
Please do.
take this.
okay. First of all, I think we're talking about two different ADMs. So we have a little bit of, we're talking past each other. Deborah has given a very detailed explanation about the family reimbursement ADM. What Ellen, I believe, is referring to is the eligibility ADM for waiver services, which is a completely separate ADM. And I agree with her that there is a massive confusion among families about how to pursue this process. The CCOs are reporting a lot of rejections at this point for waiver services, and it has spiked, particularly for children. But even for young adults who are looking for OPW services as they transition. So the eligibility ADM has changed things very significantly, and I think it does warrant more of a detailed discussion in the council, because along with the family reimbursement ADM, there's sort of where they parallel is there's more bureaucracy, more confusion, more inconsistency in application, and more overall narrowing of access for services. And I think that's what they have in common. But they're two different ADMs, and I think that we're hearing important points from Ellen about the eligibility ADM, and really should plan to discuss it in a future meeting and ask OPW for some clarifications.
And again, Ellen, I do apologize because usually there are two OPW representatives on our meetings every month, and I'm not sure. I'm
You
going to
did
email
nothing
Nina.
wrong. Don't
No, I'm
apologize.
just saying that usually there's someone here to give some insight or give some answers, and I'm definitely not going to attempt to speak for OPW. I will say that.
Don't apologize unless you made the mistake. You leave yourself wide open.
All right, so I will throw it out there again. Is there anyone from OPW? Lucy, Nina, no. All right, so we will keep moving up our agenda. Paula, you're going to get to go on a little bit early today. Is that okay?
That's great. So I get it out of the way. Can you make me a host so I could share my screen? Okay, perfect. There we go. Everyone could see that, I assume.
Yes, we can.
Okay, so let me start. Okay, so good morning, everyone. For those of you who do not know me, my name is Paola Martinez Boone. I work for the New York Lawyers for the Public Interest. The New York Lawyers for the Public Interest is a non-profit legal organization. We provide legal services to individuals, and we also provide legal services to other groups. We do have, it's legal work. You have to have a legal issue in order for us to look and assess the issue. I'm not gonna go in great detail, but what I could tell you is we've been providing services to people with disabilities for about more than 40 years. And we have services from education to housing to accessibility. So the best thing that you can do if you want to learn about our services, please go ahead and look at our website. If you believe you have a legal issue that perhaps you want to present to us, feel free to call our main line, and you just need to leave your name, your telephone number, and what you're calling us about. I want to remind everyone that lawyers are like doctors. They like go in these buckets of expertise. So if we are not the right agency for you, we will give you a referral to another nonprofit. We do not provide referrals to private practitioners. However, we'll let you know if you need one. If you don't have time during the day, if you're busy and you're not able to call, don't worry. We have a link, NYLPI.org, get help. Just click there. And once again, the same thing, your name, your telephone number, and why do you need us? And somebody will call you back with a little bit more detail. And then from that, you either will get a referral or will get to the second step, which is, a more in-depth assessment of what you're calling about. We have other programs besides the disability justice. We have a, oops, I don't know what happened there. We have a environmental justice program, a health justice program, pro bono clearinghouse. We have a lot going on. So I'm not gonna spend time because this presentation is quite long, and I want to, provide as much information on the topic as I can. Okay, why planning? The first and basic question is, why planning for the future? Well, first and foremost, because we want to preserve public benefits. A lot of people don't understand that if you don't plan ahead of time, your child may not be eligible for some services. And this came really, really real during COVID. If people were passing away, they forgot that when they got hired, they put as a beneficiary their child with disabilities, and now this person who needs Medicaid end up with $100,000, and then not eligible anymore. So we really, really need to look into if our child is going to transition from school to OPWDD fully to get, they program all those services from OPWDD, we need to preserve public benefits, and I'm going to talk a little bit more about it. Also, to improve the quality of life of our individuals with disabilities. In the past, many, many, many years ago, you weren't able to leave anything to your loved one with disabilities because it will be counted. No anymore. There are things in place that we're going to learn today in which you can actually leave something behind for your loved one with disabilities without interfering with public benefits. Also, we need to get education. We need to educate ourselves about what it means to have ID, DD, or to have a loved one with disabilities. Everyone is not in the same bucket. It's a spectrum of people with disabilities, and we need to really, really learn. And this came from my work with families, because sometimes when they call us with a legal issue, I ask them details about the loved one with disabilities, and they struggle to identify to me what it is, even though we know that if your child has been in school, there has been this plethora of evaluations, so the information is there. Also to expand and not to limit choices. First and foremost, we need to understand our loved one with disabilities capacity and the ability of decision making. Once again, it's a whole spectrum, right? We have people with disabilities capable to make their own decisions. They don't need anyone. They need support. Then there are some people that need more support, and then we have at the other end, like people who really, really need someone who will be there to make all decisions. If your loved one already have a life plan, you have done some of the information, you already know, you should know medical, behavioral, social, emotional needs of the person with disabilities. Once again, this is all about planning. We need to take action. And I have in my work working with families, some families are so afraid of looking into the future because that exposes us to mortality, and that's a kind of a trigger and a stressor for many, many of my families. And they will say to me, oh, God will provide. I'm not gonna do anything. I'm gonna hope for the best. And respectfully disagreeing with that, because doing this work, you have to learn that in order to be able to at least put your loved one with disabilities in a better place, you need to plan. We need to plan. Think about what you have. And this has come from the fact that we at New York Lawyers serve people who are poor, people who can't afford legal services, or people who are recipients of public benefits, and sometimes they don't they don't realize that there are other things that they're doing that perhaps could jeopardize eligibility for public benefits. For example, I have people that work, and through that employment they have a life insurance, they have a pension plan, sometimes they own a house, and even though they don't have a huge savings account, these things will count if your loved one with disabilities name is attached to them. And I'm gonna explain also. This is a lot of the things that I'm gonna talk about today, so that's why I'm going really, really fast. By the way, if you hear information today that triggers some personal questions, I don't want you to ask in this forum. We have over 30 people here. So you should not be airing your personal business here. I put my email on the chat, and I promise you, and people who know me know that I do return calls and I do return emails, answer my emails. Send me a little note in an email that you need to talk to me, and I'll be more than happy to coordinate with you. General questions about the topic, of course, you can raise your hand, you can put in the chat. I usually address them at the end because sometimes you jump the gun too soon, and I will address that. And once again, if it's a personal question, then reach out to me personally. Okay, I usually also talk about the letter of intent, because the letter of intent is not a legal document. The letter of intent doesn't need a notary. They don't need anything. The letter of intent is really a map of what's going on with your loved one with disabilities. It includes anything that you think is important. And with the letter of intent, the goal here is that you will have someone who really in detail knows what's happening with your child, that in a case of emergency could help you. Once again, I have to bring back COVID, even though I want to forget about it. But this was a big, big issue during COVID, that it was a caregiver who dedicated 24/7 to this person with disabilities. And there are other people in the family who didn't know where's this, where is the school? Who is the point person at the care coordination agency? Who is providing services? Who what's the doctor? Where is the medication? How many times? They didn't know anything. So the letter of intent, really, the purpose is that you write down everything that happens with your with the life of your adult one with disabilities. And you can revise it, send it to as many people as you think they might, you may need them eventually, email it, mail it, whichever way. It's not a legal document, so you can send it as many people. And the goal here is to provide enough information so someone, even if you get sick, because we cover, right? You got coughing, you got sneezing, you go to the emergency room, they left you there. So who's gonna do all the things that you do for your child? And now, for those of you who have kids with autism, routine is very important. So we need to write down those things. We need to write down routines. Who is the, if I'm your neighbor and friend, I want to help you, but I need to know where your family is so I could contact them too. So once again, it's not a legal document, but it's very useful. If you are like me who likes formats, if you type in Google letter of intent, I assure you, you find so many different formats about how to go about it, but it's just a really easy to start document to provide information about your child. Okay, because we're gonna talk about different legal documents, and most of them have to do with capacity, mental capacity. So I want to remind everyone that under the New York State law, everyone who is 18 is presumed to have decision-making capacity. Everyone. An incapacitated person is a person who is impaired by reason of mental illness or mental deficiency to the extent that she or he lacks sufficient capacity to manage his or her affairs. A ward is a person whom a guardian is appointed. And a guardian is a person who has been appointed by court. And this is important. This is very, very important because it could be confusing. When your child is a minor, usually documents will say you're the parent, mother, father, and legal guardian. When your child is 18, you only call yourself guardian if you have been appointed by the court. And I'm gonna talk about that a little bit more. Surrogate decision maker is an individual who's authorized by law or who is in fact making decisions for another. And the Family Health Care Decision Act is an act providing a process for a surrogate decision maker to make end-of-life decision on behalf of an incapacitated person. So we have some information there. Now, how do we evaluate decision-making capacity? We need to explore decisions that individual has made or facing. And the number 2 is the one that really some parents struggle with, which is balancing respect for the individual's self-determination and protection of his or her well-being. So that sometimes is a struggle for parents because many parents automatically want to protect. However, if you have an individual with disabilities who's working on their independence, working on speaking out for themselves, in their self-esteem, you have to respect their self-determination, even though sometimes you don't agree with their decisions. Now, if their decisions are not harmful, you can disagree. But once again, this is the piece in which a lot of families struggle a little bit. A person may be competent in one area and not competent in another. And that's another piece that we need to learn. That sometimes, depending on what's going on, someone could be competent in some areas and they need help in others. What are the components of decision making? Ability to communicate a choice, ability to understand relevant information, ability to appreciate the nature of situation and consequences. And when people call me about the different tools, healthcare proxy, guardianship, support decision making, those are some of the questions that I ask. When you call me, oh, do you know how to go about this? I ask these questions because I want to make sure that you understand if your child have what level of capacity he or she has in order to make decisions. Now, also rely in those evaluations. You have school evaluations, you have independent evaluations, read them. When they are provided to you, read them and ask questions because that is the information that you will need to decide what's gonna be best for the person with disabilities in terms of decision-making tools. These are the steps. We do this naturally. I just putting you in picture, but this is how we decide on things. We gather information, we understand, we identify, we consider, we weigh in, we communicate that decision, and then we implement. By the way, breaking news, people with disabilities do the same thing. So once again, we need to be aware that for many loved ones with disabilities, the exact same process. And these are the decisions domain where we're gonna live, our social activities, work, training, legal, health. These are the domains in which we made the most decisions. Okay, so I'm gonna jump into the trust because once again, this is with the idea that a lot of people need to understand what is available to them. I get this calls a lot, like families that want to leave something behind, they don't know how to do it, or they don't know what is available. So the trust is one of the things that is available to you. Now the trust is a fund in which you can put cash, stocks, bonds, property, life insurance, businesses, a house, your pension plan. So really a regular trust, you will have a grantor, which is the person who's putting the money. You will have the trustee, the manager, and you will have the beneficiary, which is the person who will get the money. Now for individuals with disabilities, we have something that is called supplemental needs trust. And the purpose of this trust is to preserve public benefits. Once again, I started with public benefits, and this is all about preserving public benefits. If you have a loved one with disabilities, you can leave money behind. If you open a supplemental needs trust, you can leave, percentage of your house, percentage of your life insurance, your pension plan, stocks, bonds, whatever, but it has to be a supplemental needs trust. Two important things when we are talking about trust, this type of trust fund is irrevocable, meaning you cannot change it, and it's discretionary, meaning that the trustee, which is the manager of the trust, will have the fully authority to make or refuse making distributions. Now, this is not so much of an issue when the trustee is also the funder of the trust, because it's your money, you do whatever you want. But when it becomes a little bit of an issue is when the family member is aging and then they want to assign somebody else as the trustee to manage. So that is when you really need to put a lot of thought of who's going to be that manager. Now, there are two different types of trust. There is the first party trust and is the third party trust. Now, the first party trust, and if you're not paying attention right now, you're falling asleep, I want you to wake up at this moment, because the first party trust is funded with the person with disabilities on money. So people always ask me, but my son was born with disabilities, my daughter has a disability, how are they gonna have money? Ladies, gentlemen, lawsuits. When you're suing someone on behalf of your loved one with disabilities, the money doesn't come to the parents. I just want you to understand that. Even if your person is an incapacitated person, the money doesn't come to you. So what you need to do is to talk to whomever is representing you in, a medical malpractice lawsuit, car accident, about first party or self-settled trust. So they could have this together by the time you settle the case. If you want to open a self-settled trust after the fact, it's too late. You need to do this before you settle the case. This account needs to be set and be part of that process before you settle the case or before a judge decides the case. Okay, that's how people with disabilities open a first party trust. Now, something important about the first party trust is because allows people with disabilities to continue on public benefits if the person passed away and there is money left, because there is a Medicaid clause here, the money goes back to Medicaid because this person is a recipient of Medicaid. They didn't finish the money here, so the money goes back to the pool. Now, different from the third-party trust. The third-party trust is a fund that, parents, grandparents, friends of the family, neighbors, anyone could put together a trust fund to benefit a person with disabilities. The rules are the same in terms of it's irrevocable and it's discretionary, but doesn't have a Medicaid piece here because it's somebody else's money. So what happens in this process is that you put this third-party trust, and if the person passes away, it doesn't finish, then you already have assigned who's gonna get the money. Sometimes people leave the rest of the money to nonprofits, sometimes to brothers and sisters, but because it's your money, you are entitled to give it to whomever if it's not spent by the person with disabilities. There's also another way that you can put money aside, and that is the 529 ABLE account. It's easier to set up, is set up by the Controller's Office, New York State Controller's Office. And this year, the amount a year you can put to save is $18,000. The max is $100,000. If you want to open an ABLE account because it's easier, it's a little bit of money, it doesn't require an attorney as they trust funds, then you can contact the controller's office for all the information. If you are looking at the screen and you click here where it says the last 529 ABLE account, it will link you to all the information about the ABLE account. I will encourage you to read it carefully before you call them, because the more information you have, then the less questions you will have when you get in touch with them. Eventually, it looks like a bank account, regular bank account, but the process is with the controller's office. So once again, another way that you can save account money on behalf of people with disabilities without interfering with public benefits. Now we're gonna go into decision-making options. Obviously, the least restrictive is always the person making their own decisions. And the more restrictive is always gonna be guardianship. And we have others in between, because like I said, when we're talking about people with disabilities, a whole range of people who are different. Okay, let me start with another less restrictive, which is power of attorney and healthcare proxy. Now, these instruments are not for people with disabilities only. I want to clarify, it's for everyone, which you all have a healthcare proxy. So the rule number 1 for healthcare proxy, the person with disabilities must have capacity, must have mental capacity. And because the person needs to be able to appoint an agent. So if I want to do a healthcare proxy, I need to identify who's gonna be my agent. The agent may be anyone I want. So that is important. Why is it important that I have capacity? Because I have to think about who is the best person to represent my wishes. In many cases, maybe a mother, in many cases a sister, many cases husband, wife, partner, whoever. So that is really important. The other part that people sometimes are confused is that it's not like when you have a healthcare proxy, you're gonna be making medical decisions for that person all the time. The healthcare proxy requires 2 doctors to decide if a person no longer have capacity to make their own decisions. So 2 doctors need to be on board saying this person right now, because they're in a coma or they, very hurt severely, somebody else need to make the decision. That's when the agent comes and does that. Healthcare proxy is similar, but for financial affairs. So in the past, it was only one that it was called the durable power of attorney. And once you sign it, it was immediate. Like the other person could start making financial decisions for you. Now we have another option, which is the springing power of attorney, which names an agent in advance, but does not grant the legal authority until that person is incapacitated. Okay, so now we have more options in terms of the healthcare proxy. Most important here, the person must have capacity. And I say this because I get callers telling me that, oh, my son have all these things, but he knows how to write his name. He doesn't know really how to read. He doesn't know really, but he knows how to write his name. I want a power of attorney. Well, it's really not an issue whether they know, do they have capacity? Once again, this is all about capacity. Capacity, capacity, capacity. I cannot stress it more. We also have a least restrictive, which is the supported decision-making. Now, I'm gonna give you a little bit of history. Supported decision-making came to New York 6 years ago, and it was really initiated by a judge, because this judge was seeing that there were a lot of individuals applying for guardianships, and when she read the documentations, these individuals didn't need a guardian. So, but at the time, nothing else existed. Supported decision-making have existed in other states for many, many years, but it wasn't here in New York. So she started a pilot program 6 years ago. And that pilot program was very successful. And therefore, right now, as of summer last year, supported decision making was made law. What that means is that the process is a process in which at the end, you end up with an agreement, which is a valid agreement that you can present. So this is with the idea that, once again, when we are talking about people with disabilities, everyone is different. And this is to address the areas in which that person is capable to maintain the ability to make decisions, while in other areas they need what is called supporters, a circle of support. And that's really what this is allowing people with disabilities to continue making decisions about their life, while having that group of individuals who are going to be there to support them when they need it. So here is the law, it's the Mental Hygiene 8203. And it is well put together. It tells you everything about supported decision making. It also explains to the supporter what their duties are. And it has been very, very successful. I will say to you, if you have an individual with disabilities who you believe that may be a better candidate for supported decision making, you know, they have a contact. If you click any of those links, first of all, they told me that when people call me and I send it to supported decision making, to let them know that they twice a month they have these informational sessions. So if you are curious about, you want to learn more, they do it every month, twice a month. They also want you to watch the videos, because there you're gonna learn about people with disabilities who have testimonials, as well as parents of people with disabilities also providing testimonials about supported decision making and how the process has been for them. So I will say to you, if you really want to learn about supported decision making, and encourage you to call them. Obviously, if you have any questions, you can, my email is right there. You can call me and I'd be more than happy to talk to you in great detail about supported decision making, as well, or any other thing that I've been explaining here today. There is also more information. Once again, is well put together. All the information is there. Really, the process start with you calling them. They're gonna interview you. They're gonna assign a facilitator, and the facilitator is gonna work the family all the way to the agreement. By the way, supported decision making, I think last year, was funded by OPWDD. So OPWDD is on board with supported decision making. Then we have another choice, which is surrogate decision-making committee. And this choice is really one for when families don't have anything in place. That's why, once again, planning is very important. If you have an adult with disabilities and you haven't gone to the process of supported decision-making, or if guardianship, what we're looking into, because that's what is appropriate, and you haven't done that either, and then something happens, and I have people calling me about dental work. If you love one with disabilities, an adult, they might need dental work. And if the dental work requires for this person to be put to sleep, most likely the dentist is going to ask you to sign. Somebody needs to sign. And then he will look at you, you will look at them, and you will say, and the mother, and the grandmother, and the father. And the dentist will be like, okay, who has the ability to sign on behalf of this person? Who is the guardian? Do you have supported decision making? No. So if the answer is no to those things, and the person with disabilities is not able to approve this procedure, then we have surrogate decision making. And really what the process is that you fill out forms and you request that for this particular procedure, they approve because the person is not capable to make this decision at the moment, and this needs to be done. The downside of this is that you need to wait 14 days in order for them to review the paperwork and send it back to you. I hear from some coordinators that sometimes it takes less, like 10 days, but once again. And by the way, don't worry if it's an emergency, then you don't have to worry about anything. Emergencies are going to be taken care of. But this is for something that could wait. But once again, I want you to know that it exists. I want you to know that it's out there in case that you need it. I already talked about family help. So guardianship. So once again, a guardian is someone appointed by the court to make decisions on behalf of another. Guardian could be appointed to make financial decisions, such as guardian of the property or guardian of the person, or both. Now, for most families, the only guardianship that you're gonna fill out, if this is the thing that you need, is guardianship of the person. Why? Because if you have any property that you're gonna leave behind, then you need to look into special needs trust, supplemental needs trust. You don't look into guardianship for property. You look into a special needs trust or supplemental needs trust. So let's start by saying that most people will need a guardian of the person. Now, the guardianship for individuals, adults, and we're talking about adults is 18 and older, is Article 17A guardianship. And the Article 17A guardianship is specific for people with intellectual disabilities and or developmental disabilities. That's specific for that population. You don't need an attorney. Once again, I know people see these documents and sometimes they're panic. You don't need an attorney to do a guardianship. It's paperwork. The court has all the paperwork online. If you need me to send it, I'd be more than happy to send it to you. But everything is online, from do-it-yourself guidance, from a glossary of terms, from a checklist of what you need. So everything is there for you to do. You don't have to do everything in one day. It's not one form, it's a series of forms. You can do one, save it in your computer, and continue the next day. You can cut and paste from one form to the other because all the forms start the same way. When you're using the do-it-yourself tool in the core website, actually ask you a series of questions and then it will populate the forms. So it's a lot of resources here for you to do. Now, in this process of guardianship, if this is what you need to do on behalf of your loved one with disabilities, it could be one guardian or two guardians. That's called co-guardianship, meaning that both guardians have full power to make decisions on behalf of this person. There is also another line for a standby guardian, which means you can appoint someone, but that person doesn't have any legal authority until the guardian or guardians pass away or become incapacitated. It's basically like the vice president of the United States. They don't do anything unless the president dies. So it's the same thing with standby guardian. If you want to add more people, you have a first alternative and you have a second alternative. So you have everything there that is needed in order to start, the guardianship, and you can have all those individuals or you can have only you, if that is your case. And once again, everything that you need is online. Then the other guardianship is Article 81 guardianship. This is the one that Britney Spears used to have. And really you can, because it's a guardianship that you're able to tailor, you can also have it for a person with IDDD. The issue with this guardianship is it's costly. You're gonna have to hire an attorney. You're gonna have to pay for evaluators. So really costs a lot of money, but it's another choice. If you have those funds and you think that this one is a more tailored guardianship, then you can go for it. We all often think about when guardianship is appropriate. And guardianship is appropriate when we have an individual that because they don't have a guardian, they cannot get what they need. But it really is an intrusion of the personal autonomy. And I want you to think about that piece. Also, a lot of things that you may think that is covered by guardianship is not. And I go into this because once again, I work with families, sometimes family call me, and number one is always money management. And because the loved one doesn't know how to, manage their money, then they think that guardianship is appropriate. So what I want you to think about is that, there are so many services through the agencies that could teach your child how to manage money. Also, this is an insane expectation of like people with disabilities must know how to manage money all the time. I can tell you that half of the people that I know doesn't know how to manage money. But we are asking of people with disabilities that, they should know how to manage money. I know it's a skill, and I know the agencies have programs, and I think that's the work to be done. But that should not be the only thing that you are thinking about when you are trying to apply for guardianship. Number one. Number two, also, because you apply for guardianship doesn't mean you're gonna get it. You can be denied guardianship, and I have, that happened to families because when the judge reviewed the paperwork, they realize this person have some level of capacity and want to keep it that way. Why would I assign someone that is going to tell them from, what to eat and where to live and who to, mingle with? So once again, because you apply doesn't mean you're going to get it. So that's why more work for you to do in terms of what is available and what's going to be a better choice for your loved one with disabilities. What you're looking at right now is the different surrogate score in which you will go and apply for guardianship. The process really, once you fill out the paperwork, if you fill them out online, you print them, you have to have a notary public sign them, and then once you have the packet together, you don't need an appointment, you just walk into the surrogate score and submit your paperwork, and from there you'll be having interactions with the court. They might send you something via mail. They might call you. So once again, once you submit the papers with them, you are dealing with them and about the process. This process could take like 3-6 months. It's a lengthy process. So also requires for 2 doctors to fill out affidavits. So meaning that they need to be in agreement of these guardianships. And I also have seen and I have received calls in which the doctor refused to fill out because the doctor doesn't feel that this person is a guardian. So once again, but you do need 2 doctors, or 1 doctor and 1 certified licensed psychologist in New York to fill out the other one. And the other pages are resources for you to look at. And if we have time, I could take some questions. Once again, no personal questions about my son, my daughter. If you have those, please call me. My email is on the chat. And once again, I'd be more than happy to talk to you about anything and everything that you have a question about.
Thank you so much, Paola. That was great. So informative. People were asking, you did send me the presentation earlier. So I'm just going to put it into PDF so people can't alter your information from the PowerPoint, and I'll get it on our website with the recording later.
Perfect.
Rochelle,
Thank you so much. Thank you so much.
Thank you. Rochelle, you have a question.
I do. Thanks so much, Paola. This was very comprehensive. I've been hearing from families, not necessarily just in Brooklyn, but throughout the city, that there are some issues with some surrogate courts where people who are non-English speakers are being denied a guardianship hearing. Have you heard anything about this?
That's always been an issue. What I suggest to families is to ask the clerk to show them the piece of law that says that they cannot be guardians because they don't speak English. Especially, and I say this, I hear that all the time from the Queen's Court. Is one of the that keep asking. So once again, you don't have to be a holder of a green card to be a guardian, and that's another piece that you need to know. And also, whoever tells you you cannot be a guardian because you don't speak English, you go ahead and ask them, can you show me the regulation that says that?
Thank you. Does it work?
Well, nobody have called me back, so maybe it does. Christopher.
For the record, and I like to say, because I have been going to courts regarding, the transit stuff. I do see different languages it is available, as well as something else that we may have forgotten. If a person is not just blind, but they have other devices, there is also available too. I have seen that in federal, state, and I'm going to say starting now, it's getting a little better in the city courts, but housing is something we still got to keep an eye on. But it's still growing, but we still got to continue. Thank you. I'm just being quick on it.
Well, in terms of guardianship and the day, because you're gonna get a hearing date, you can ask for an interpreter that day as well. So you have the right to ask for interpretation services at that time.
And that's why I let you say it quick.
There was a question in the chat. Someone was asking, is there a help desk at the courts?
Well, they have the clerics. When you go to the court, the clerics are the individuals that should be helping you.
Any other questions for Paola?
Paola, hi, Sister Haida. Sexual consent is also like 18. I know it's not related to guardianship, but I'm just asking since you're a lawyer.
I am not a lawyer.
Well,
I am not an attorney, but I don't know what you mean. It seems that it's more to it, and I wouldn't. And I don't know what you mean about that. I really don't. I'm not understanding.
So, like, at what age can a person? I know atypical people make that decision on their own, but is there like an age where it's like you're able to make your own decisions about your sexuality and sex and that nature?
Well, once again, as any other rule, if the person is maintaining capacity, the same rules apply.
So it's 18. Okay.
Once again, we have to look at individuals with disabilities as any other individual, right? Unless they are deemed an incapacitated person. But if the person is not deemed an incapacitated person, the rules are the same like anyone else.
Okay, that makes sense.
Anyone else have questions? Okay, if no one have questions, you know where to find me. Please email me if you have any questions, concerns regarding this topic. If you have any other legal issues, you need to call the main number, just because if you call me and it's an issue that is not related to this topic, I have to send it through the back to the front, sort of, because we have a screening. But if it's about this topic and you have a personal question that you don't want to air here, more than happy to set up a time to speak with you. Thank you, everyone.
Thank you, Paola. Appreciate all your continued support to our field.
Thank you.
All right, that was excellent. So I'm going to circle back because I do see Robin is on. So Robin, do you have an update from OPW for us?
No, I don't work at the Brooklyn DDRO. A lot of the supervisors have a mandatory meeting in Manhattan. I'm not sure if they were aware of this. They didn't tell me about it. I just, the Graves had texted me that you were having the meeting. So I just logged on, but I don't have any updates. I'm not authorized to provide any updates either. Sorry.
Oh, okay. Well, no problem. Just wanted to check in.
Mm,
Thank you.
You're welcome.
I'm sorry to cut in, Brian. I'm trying to help Lucio Mezzi get in. If maybe someone can help me get the link to her, it would be a big help. Because my phone's acting.
I already sent it to her, and just the reason is right now, as you heard Robin said, there was a supervisor meeting. It's been a little crazy. Am I right, Robin? Thank you.
All right.
Thank
All right. So
you.
if she can get on, we'll give her some time, but let's just keep moving on the agenda to keep the meeting moving. So next up, updates from the committees. Any of our Brooklyn Council committees have updates, want to plug a upcoming meeting? Go ahead, Debbie.
Okay, I'm
Okay,
doing this for, okay, Rosal asked me to do this. The last meeting we had, we have cut our meeting down to 1 hour, because right after us is the legislation committee that's chaired by Lucina Clark. We had David Krasner from Hummusbeck was explaining how home care or how to get a CHA for your families with developmental disabilities. It went very well. We do have a PowerPoint. If you need it, please email us and then we'll forward it to you. Now, the next Family Provider Information Committee is going to be on Valentine's Day from 10 to 11. And ACA, one of our care coordination agencies, is supposed to do a presentation. Okay, so did you want me to do the advisory council now or not?
No, because that's separate from the
Okay. But
the
I
committees.
just
But thank you.
they just asked, but she also asked me, that's one more thing. If anybody would like to make a presentation at the our Family Provider Information Committee, please email Rosal or just email me, Deborah Greif, and I will make sure that we will try to set it up. But we appreciate all help and support. Thank you.
All right, and everyone's contact is on our website if anyone needs it.
Hey, Brian, this
Lucina.
is Lucina. Can I go?
Of course.
Hi, everyone. Good morning and Happy New Year as usual. We have until January 31st to say Happy New Year. It's so great to be a part of a committee. I want to thank Ms. Maria Willis. She is the co-chair of the Legislative Committee. It's, I know it's starting back up fresh and really getting people to be involved. One of the things we're asking is that any provider or parent who's here can be a part of the Legislative Committee, because more voices, we can power up more people to advocate for yourself and for your children. I know we have the legislative, the 5 borough legislative breakfast is coming up. Brian already put on the screen. It's in your emails. Please come on. You want your elective officials, you want your officials to see your face, to hear what you have to say. And also part of the legislative committee is what we want you to continue advocating. It's not only during legislation season, not during the bill time or the budget time. The more you are involved in your community, calling your legislator, whether it's your assembly, your city, your state, let them know that you have a child with a disability and what your concerns are. I know the major concern we've been talking about in the legislative meetings is about the COLA and even raising the pay rate for your DSPs or anyone. But the thing is, we have to be involved. If these DSPs are very important to you, you have to let your council people know, your senators know that they are valuable, because without them, you cannot work. You cannot produce what you need to produce for yourself. So please join us. We have our meeting with the third Wednesday at 11. So please join us. Brian always sends out the email so we can be a part of that. The more providers, the more people we have involved in the legislative committee, it is going to be powerful, because more voices, they can be heard. So I want to thank Maria also for being a part of this amazing legislative committee, and all the people on the team, especially Brian, and bringing us together. So we are learning. So we are getting to be more powerful, and our voices are going to be heard. I see the NIDA. I was forget to ask oh my gosh, IAC, about the Capitol rally. Are they providing a bus? Are they providing, or you drive up there? I forget to ask him that question.
I don't believe they are providing that. They do have, if people are staying over, they were able to secure some type of discount at a hotel.
Oh, okay.
But I think if each of the regions have a big enough interest in it, we can look at the councils putting together transportation or securing a bus for people to be able to get up there.
Yeah, well, that'd be good. But I mean, again, you know, I mean, these things are always hard for most people to get to. But again, for us as a legislative committee and for you as a provider, write a letter, send an email. You know, it's important to send an email. Just give a phone call to your legislators. Say hi, you know, I'm part of this committee, or hi, I'm a parent. And that's how we can make our voices stronger. So we are working really hard. This is our first month really on the ball being there's Maria and I, and we're looking forward to a lot of ideas and, you know, assistance, because we're going to do this together. That's how we can survive. So thank you so much.
And Lucina, before you go, what's the date of your next meeting? Do you know it offhand?
Hold on, let me see. Should we?
You're supposed to follow
February 14th, Valentine's Day.
Second Wednesday.
Second Wednesday from 11 to 12. Every
Thank you,
second
Valentine's Day.
Wednesday. February
That's what I was
14th is the
trying to
next
tell you.
meeting.
Thank you.
Thank you. I made a mistake. It's the second Wednesday. So it'll be February 14th at 11 a.m. We do it for an hour. Business could be done within an hour because everybody have busy lives.
Excellent. All right. I know, Jahida, you wanted to say something?
No, hi. I just put the flyer with all the dates for the Brooklyn Employment Committee on the chat. So if anyone wants to click on it, it's a PDF. And then we'll be sending out one for the month on February 6th at 3 p.m. And I believe we're going to be talking about the SEMP ADM.
Thank you, Jahida. And for anyone interested in the employment committee, they are trying to make the meetings a little bit later and even do some evening meetings for people that have trouble attending during the day. Any other committee updates before we move on?
Good morning,
Brian.
Oh, sorry, Chris.
No, Paola's hand was up.
Well, I don't have a committee update, but I forgot to mention that this presentation is available for free to any agency or parents groups or anyone who may need it. The only requirement, and I have to say I'm very firm on that, is 10 people or more. That's the only thing that I require because, you know, as you see, it takes time. But other than that, it's free. And I'm the traveling circus, so I, present this anywhere and now in Zoom, in the Zoom space. So
Paola, do you do it in the evenings too, or only mornings?
It's usually during the day only. Evenings are a little bit tricky.
Okay.
Thank you.
Thank you. Marjorie?
Good morning. Sorry about that. I just wanted to remind everyone that the Children's Services Committee meeting will be held on January 30th at 9:30. The event link is posted on our website. In addition, we're going to have Include NYC there for families to discuss the Turning 5 process. It's been a little bit daunting this year. The system in which it has happened for families in the past is changing a little bit somewhat. So families are a bit confused, so we figured we'd provide them with this support. So if anyone can join us, that would be great. Please spread the wealth in terms of information and get that information out so that we can help support our Brooklyn families. So thank you.
Excellent. Thank you, Marjorie. And I believe I had seen Pilar. Up here. There you go.
Hi, everybody. I just wanted to remind, I put it in the chat. The next Transition Service Committee is supposed to be February 15th at 10 a.m. I also put in the chat just our email address, any questions you can send about transition services. We are always looking for people who want to present about interesting services or changes to transition services specifically. Our last meeting, we really did go deep into a conversation about the change of graduation age from District 75 schools, allowing students to stay until they're 22, and how does that affect transition services? So I expect in February, we'll be continuing that conversation. So if you are interested in presenting or have any specific topics, please reach out to Heather or myself at bktransitioncommittee@gmail.com. We also have our Google Drive. You can share resources, flyers. If you have issues getting on the drive, which I know some people do, just feel free to shoot us the flyer directly and I will post it. On another, I guess, semi-related note, our attendance for transition committee has been kind of low. We're trying to encourage care managers, if you could get more care management to participate, so that they can find out about available services for the people that they support. That would be really helpful. And we also would love to get more parents and families and advocates like asking questions about transitional services so we know what to present about. We know people have a lot of questions about eligibility and getting into, adult service and transitioning from high school, but we're not getting the questions. So if you could just also put the word out there that we're hoping that we can answer these questions and help people to brainstorm what to do. But the attendance is not where we would like it to be. So just reach out to me and Heather or reach out to Brian, and we would absolutely love to host more parents and families so that they can find out more about their questions. On another related note, I personally work for HRC New York City, and I am the Director of Community Outreach and Intake for Brooklyn for Adult Services. So I see Chris put in the chat. I'm also going to be at the resource fair representing HRC. That's on the 29th. I will be there at the library, UU Church Library. If you know anyone that's looking for day services, employment services, or getting into services with HRC, please let them know. They can contact me directly, and I will connect them with appropriate programs. And I think that's about it. I don't know if anybody had any other questions about transition committee or adult day service in Brooklyn, adult services in Brooklyn, education or employment. Please feel free to let me know.
Thanks, Pilar. All right. Did I miss any committees? I don't believe so. So next we have the Brooklyn Family Support Advisory Council update from Debbie.
Good morning. Thank you very much. As you know, in January, instead of holding our meetings in person, we had on Friday, January 12th, and I want to thank David Schaefer from State Senator Prasad's office for coming. We appreciate it. We did very well at the Brooklyn Heights Library that was fixed, was revamped. It's beautiful. We were able to get a lot of people signed up for the reduced fare OmniCard, but we had a big surprise and we were thrilled. We have New York City ferries, which if you already qualify for a reduced fare, fares, or you're a senior, their reduced fare card is $1.35. We have their link and information on the Brooklyn Family Support Advisory Council, which we shared with the Brooklyn DD Council. Now, I have a big important announcement. This Thursday, January 25th, it's a big one. All the 5 councils are we're doing a joint meeting in reference with housing assistance. We're going to have Synergeria and also AHRC, and it's going to be from 10 a.m. to 11:30 a.m. We do have links it'll be on Zoom. The advisory council has links. So if you're also from any other boroughs, their advisory council also has links, and it will be put on the chat. I'll have Christopher do that for us, and he probably did already. Now, the next thing, I just want everyone to know, in January, we have found that if we try to do meetings in person on our regular day, the third Tuesday, it doesn't work. So before I say the other thing is, please also come on Monday, January 29th. We're going to have from 11 to 1 p.m. at the New Utrecht Library. We want to thank Kerry Banks again. The Brooklyn Public Library Inclusive Services will have New York City Ferry, the Brooklyn DD Council, the Office of OPWDD. We're going to have the Center for Living of Independence, MTA Reduced Fare, and Omni and other local agencies. New Utrecht, it's right near if you need the accessible station, I suggest if you use the D train, go to Bay Parkway and take the B1 bus back going toward Bay Ridge. Also, the R train has an accessible station at 86th Street, and you would still take the B1 bus there. Now, if you do need interpretation request, please call 917-751-4980 or email inclusiveserviceevents@brooklyn.newyorklibrary.org. And we'll also have a special guest. We hope she'll make it. We have Miss Wheelchair New York. She's going to try to make our February 9th. That's when the Brooklyn Advisory Council is having their meeting, because we found during school recess, during the president's holidays, we get nobody. So now we're going to be this is Friday, February 9th, from 10:30 to 12:30. It's going to be in the Information Commons Lab, Central Library, 10 Grand Army Plaza. And we're going to have a talk with what we're going to have is the Interborough Express, that train that's supposed to, that usually see the tracks where the freight trains run. So they want to hear what you think and feel. So we do hope you'll all make it. The other thing we'd like you to all know, the updated Brooklyn Family Support Guide is on the website for both the Brooklyn DD Council and the advisory. The advisory would be www.bfssac.com. That's our website. Everybody's invited, and we will look forward to seeing everyone. So that's it. Thank you so much. Thank you. Any
Thank you, Debbie.
There is one thing that she left out, Brian. Just to remind agencies, as to remind you, because it's on our website, if you're asking for a table, please email us. Please note the 29th is full. March 8th is getting full. But we ask you to please email. This email went out to all agencies because we got to.
Correct. And please
let me explain this quickly. Let me explain this quick because we got time, so I got to do this quick. We have to follow the ADA regulation of 5 feet. There's got to be room for a wheelchair walker and fire marshal code. It is very serious, if any resource fair. And the library is giving us the space for free. So please understand, for the record, I'm saying this to Brian, you can understand why I'm saying this, for safety concerns, so other people can go through and walk through. So we do not forget you, but we ask you to please email and we will add you to the list. I want to be clear for the record on that. Thank you. And sorry to interrupt, but this is one piece that has to be in for the record.
No problem. Please, everyone, work with us. And you can come, but not for the table, but we can leave your information, which will be shared in all the Brooklyn Library locations. So if you don't have a table for you, please come anyway with your information with your agency, because the librarians get a lot of questions about OPWDD agency. So that's a big way to help us. Thank you.
Thank you, Debbie. Chris, can you do your MTA update quickly so we leave some time for announcements?
I can do it very quickly. It's very easy. Some of you, please be aware that Brian's going to email this out because it's very simple. MTA Capital is coming up on February 6th. I encourage everyone and all the agencies in this room, because I know we have some self-advocacy groups and elected officials. Please put in what you're looking at the Capitol for future accessibility stations, devices, accessorized, and MTA buses. Number 2, also want to let everyone be aware. I also put out a report. It also has what elevators are out, what elevators are being replaced. The reason is a lot of them breaking down. We need to get them fixed. There are accessible reroutes. Plus Euclid Avenue, where the DDRO is technically the destination accessibility. There is a special shuttle bus that will be running from Euclid Avenue to Utica Avenue to the next accessible station. So therefore, they can connect to the A and C train. And all for the heck of it, connect to the next fatter bus to get them out of where they have to go. That information will be coming out soon, but I'm just letting you know, Accessory has been using those for shuttles. Conductors are supposed to make that announcement. If you don't hear that, please encourage the MTA accessibility to let them notify them immediately. Also, just to remind everyone, this is the last one, congestion prices, they are mentioning accessibility on this. I will strongly ask everyone to please go on to the website, which that is part of my report, to read page 26. It does mention the exception for people with disability and seniors. If you have the handicap plaque, you will not have to pay, but you have to read it very carefully because the news media has not mentioned it. You're only seeing is the full fair price. So I'm going to tell you, the last person put that in that book was the late Edith Prentice, and she's already been saying to everyone, read the book or read the information that I have gave you. I am encouraging everyone, please, there is a public hearing coming up. We need to hear everyone's comment. And when I say everyone, that's including parents, individuals, agencies, and that goes double for Paola's New York Laws of Public Interest, because we want to hear accessibility. But I do want to remind everyone, MTA's now has more control of it. Jano Lieberman and Kamal Awara wants to hear the accessibility comments, not criticizing, but we want to hear every idea in the book. So if you can't be there, please put a letter in. And I hope the letters will go also to the councils as well. More supporting, more of this funding will actually help to get more accessibility to this, not just the train stations, but also getting attention to make sure that more accessibilities, not just the train stations, not just the buses, but making sure everything is safety and more for people who can't see or hear. We are working on that, and it's still going to be work on. So any questions, you know where to find me on my email at chrisgreif@yahoo.com. Thank you, Brian. I'm done.
Thank you, Chris. All right, so we have about 8 minutes left. Any agencies want to make announcements, just put up your hand and I will get you in as soon as I see it. I already see Doris, so please go ahead.
Hi, good morning, everyone. My name is Doris Khan, and I am the Outreach Coordinator for New York State Institute on Disabilities. First, I want to thank Paula for doing an excellent presentation. It leaves us, we have a lot more questions, but as you said, individuals have to call you directly for individual questions. NYSID has openings for evaluations for non-Medicaid individuals who live in the Bronx, Brooklyn, and Queens and Staten Island. And that's for the purpose of obtaining OPWDD eligibility. And speaking about transition and listening to everybody, it is imperative upon families to start that process early, not wait till child is 15, 16, or 20, or an adult, and then he needs OPWDD services. We also provide crisis management services, and that's coordinated by Juliet Hawkins, and she serves families that have OPWDD eligibility in the Bronx, Brooklyn, and Queens. We also provide reimbursement for goods and services in camp, and those individuals have to reside at home and live within the 5 boroughs. We also have tickets for individuals and their families. Again, you have to be eligible for OPWDD, and you cannot have self-direction. If you have self-direction services, we are sorry, but we cannot provide you tickets for outings or our transportation services, which we have transportation services for individuals with OPWDD eligibility in Brooklyn, Bronx, and Staten Island. So if most of our services, except for evaluations, you need OPWD eligibility, but if you have self-direction, we cannot provide you tickets or transportation. Thank you. And I put all that, the information and contact information in the chat at the beginning. So people have to scroll up.
Thank you, Doris. And this will all be posted on the website with the recording of the video.
Thank you.
And if anyone doesn't know, it's under resources when you go to our website, bkddcouncil.org. If you go to resources, you can find all recordings and all of the chat transcripts. There was another hand that just disappeared.
That was Sandy Naper.
All right, maybe we lost her. Any other program openings or announcements? We have 5 minutes left. I just saw Natalia, your hand went up.
Yes, it did. I just want to, I'm at AHRC, Natalia Lisoy. We have a program an intensive parent training program. And it's different because it's specifically designed for the parent who's living with the IDD and their children are in the home. And it's very important. It's not well known. And there are parents who have the IDD with children who are missing out on this service. So we are in Brooklyn and we are in Queens. I put my information in the chat. Please feel free to reach out to me if any questions, concerns, and it is OPWDD eligibility. And of course, the TV and psychosocial and psychological evals are also needed, but I can answer that further if you reach out to me. And again, the information is in the chat, and I believe on the drive, it has a flyer as well. Thank you.
And I believe Natardi will be joining us in March to do a presentation on that program for the
Yes.
council.
And I have to say, Paola, thank you, because I worked with you in the past, and it was great that you can reach out. It was great connection. Thank you to help one of the clients.
Thank you.
Just
Right,
a
any
quick,
other?
here,
Go
just a quick announcement. I did put it in the chat. Basically asking parents, providers to support the Traveling with Dignity bill that's was sponsored by 2 senators and 2 assembly members. And basically it's for people with disability, veterans, seniors, and others who use wheelchair. And adult changing tables allows them to fully enjoy an event or experience. However, these simple additions to public venues are not mandated pieces of accessible equipment. So the bill is basically asking that at all public places that there are changing tables that will accommodate adults, basically, with disability, veterans, or what have you. So I did put it in the chat. There's a flyer, just asking your legislators to support the bill. Thank you.
Thank you. And again, I don't see any other hands. So just so everyone knows, our next meeting is Monday, February 26th at 10 a.m. And we'll be having a presentation by Sarah Kogan of Proud Autistics Unmasked Social Exchange, a new program. They go by Pause. It sounds really interesting, especially for some of the less capable individuals who may be nonverbal. I think it would be a really good presentation. So please join us, in addition to all our other great updates that we hold on a monthly basis. All right. I hope everyone has a great rest of their day and week. Thank you for joining us.
Thank you.
And this should be posted on our website probably by the end of the day. Take care, everyone.
Thank you.
Bye.
Thanks so much.
Bye, everyone.
Have a good day, everyone.
Have a great day, everyone.